We have several Aboriginal health workers in our team that have the ability and the family connections within our community, where we've actually got community members coming to us, asking us for help because they know that they can trust us.
It's just so good to have a familiar face that you can relate to.
It helps them to open up and feel comfortable with sharing what's going on in their life, and not just addressing the issue at hand, but it could be stemming from something that's happening in their home as well, in their community.
People can't sort of think of what we would class as the normal things of life when they haven't got a good roof over their head, or when they haven't got employment, or when they're a long way away with no transport.
Within my role, if people are accessing our service, I feel really lucky that I can actually go and pick the people up and bring them to their appointments.
Dubbo is very unique, and it's probably one of the most unique birthing sites in the state. Covers and services 2/3 of the state of New South Wales, so that says it all really. The biggest thing is to make them feel welcome, because to start with, they're birthing off country, and that is a really big part of that cultural sensitivity, and we have to embrace ways of making that more pleasurable by having, say, recognition of their country in this space.
So the Building Strong Foundations program is about best start to life, so it's recognised that 0 to 5 years are the most influential in setting up a child's future. Our program is designed around support for families.
Doing the belly casting, it's not only about engaging with our women and providing them with a cultural connection, because normally at the end it will either be the woman or a family member, aunt, uncle, will actually paint the belly. So it's bringing so many different areas together.
In all of our facilities across the Far West, we have a dedicated hospital room that can be used for people at the end of their lives, and it has a family room attached to it. It's very culturally sensitive, that area, so that particularly for our Aboriginal patients and their families, it means that that can be a private space, but a space where they can be outside, and we can even take the hospital bed out.
The Aboriginal community will then come into our centre for their new consults, see this artwork and see this person that in their community has gone through this, and they can make a positive connection to this person. It might make them feel a bit more comfortable with having the treatments that we're giving.
I started off in physiotherapy when I first joined this traineeship. That was amazing. Jumped over to speech pathology. That was interesting, but occupational therapy has won it over for me. I'm the first person to go to university in my family. I'm the first person to finish year 12. So it's been like a really great experience for me. My mum, my nan, my dad, everyone's proud of me.
Just being with the team, they're really supportive. Everyone out here is smiley. They'll talk to you about anything you ask.
With the program that we did with Bulgalina AMS at Tweed Heads, we managed to increase their renal registry 5-fold. So they went from around 5 patients identified as having kidney disease in the AMS up to around 70 patients identified as having kidney disease. The important thing is then we can treat them and we can educate them so that that kidney disease doesn't progress to needing dialysis in the future.
You know, 50 years ago, Aboriginal people weren't allowed to use their own language, and now we can have it on our boards in, 2 quite significant public hospitals in regional New South Wales. Absolutely amazing. School children that have come in here and seen the boards, kids now learning Wiradjuri language in schools, then it translates across to the hospitals.
I'm wrapped in the way things happen here. I feel so relaxed, so comfortable, and with the respect and everything that they give you here, it's unbelievable. I wish it was outside. That happens in here. I'm really happy here.
We look at what the community requires from us, not what we think that we can actually give the community, but what they need.